community. And then I'd like to talk about COVID-19 as well. So one of the main focuses I want to really make sure that folks hear tonight is that our community is a monolithic group, often referred to as Asian Americans and Pacific Islanders, but we have more than 17 million members and 50 different races and ethnicities, and we're just put into this huge category. And among us, we speak so many languages and have so much diversity, and a lot of times it's this single category of Asian Americans, Pacific Islanders that really hides a lot of the disparities and challenges that our communities are facing. So when you look on the surface level in general as a whole, Asian Americans seem to be much healthier than non-Hispanic whites. Our life expectancy is the same, sometimes higher than non-Hispanic whites. On a whole, we seem to have the lowest rates of obesity and the highest rates of educational attainment and really high median incomes. But when you take a deeper look and go below the surface, you can see that, here, it looks like Asian Americans are doing really great in terms of income, but this is one that unpacks what's going on between the groups. So, you can see Asian Indians are at the top with household income, but as you get lower and break down the communities by groups, there are some groups that are not doing that great in terms of income status. So, we have Mongolians, Burmese, Bhutanese, other Micronesians who are earning just over $25,000. And this is compared to, if you look at the previous slide, where you had African Americans earning a little bit over $30,000 at the lowest. But if you were to break down Asian Americans, we're actually earning less. There are some groups that are earning less than African Americans. So it's really just, again, to highlight that there are a lot of inequities within our community if you break down the data and have it disaggregated. I want to talk about insurance status. And again, this is about the Affordable Care Act, and it eliminated a lot of the disparities in health insurance between Asian Americans and whites. The ACA allowed a lot of people to sign up for health insurance through the marketplace. However, there are still disparities within our community, and research shows that Korean, Vietnamese, and other Asian Americans are significantly more likely to be uninsured compared to Indian, Chinese, or Filipino Americans, for example. And so this is, again, just to highlight that when you don't look at Asian Americans as a monolithic group, we have a lot of challenges that we're facing. And the other issue too is that I want to highlight is just having health insurance coverage doesn't mean that you are getting health care. And this is really showing up in a lot of ways for our people. And we have a lot of health disparities going on. And, in just my research for this presentation, I learned a lot myself personally. So even though I work in healthcare justice, and I do a lot of work around health inequities, I have learned so much about health disparities that are within Asian American communities, things that I didn't know before. And I wanted to share the slide and quote with y'all from Steven Yeun, who is an actor. He's starring in this film called Minari. I hope folks get a chance to see it. But I think this quote really encapsulates how I feel a lot as an Asian American. And so I'm just going to read it out loud. And it's, sometimes I wonder if the Asian American experience is what it's like when you're thinking about everyone else, but nobody else is thinking about you. And I can certainly say that that experience is why I didn't really know a lot about the health disparities facing our community until NCAT asked me to present, and I went and did some research because oftentimes, I think that is one of the biggest challenges facing our community is, how to be more visible. So one of the main barriers to care is language. Almost 75% of Asian Americans speak a language other than English at home. And we have so much linguistic diversity. It's not enough just to have 3 or 4. I mean, there's really just dozens and dozens and maybe perhaps hundreds, but there's just so many languages that are spoken by our community. And I think one of the other barriers too, at least I can share from a personal experience, is that even if you are a heritage speaker in the way that I am, I think a lot of times children of immigrants serve as translators for their parents, but translating in a medical setting is extremely difficult. It's a type of vocabulary that you just don't use on an everyday language, a basis. Sure, I speak Korean, and I can talk to my parents all day long about weather and cooking and food, how I'm feeling, but I cannot talk about my liver. I don't know how to say tuberculosis. I don't know how to say chemotherapy. Those are just, that's just another language that's out of my skill set. And so it's really just to say that even though a lot of immigrants do have their children who speak a level of fluency, with their language, it's still really difficult in the healthcare setting to translate for elders and for ourselves. So language is a huge one. And again, like when you look at the language access and how it works, like when you are looking at between the groups, is that on a whole, people who say that they don't speak English very well, that's 32% of the Asian American Pacific Islander community. But when you're going deep down into separating it again by groups and disaggregating the data, you have some really high numbers. So Vietnamese folks, 48.9% who say that they don't speak English very well, or Chinese who say 44.8, but maybe Asian Indians who have a lower percentage and of folks who say that they don't speak English very well. So really just kind of highlighting that there is, again, a lot of diversity within the community in terms of, things like how well people feel like they speak English and why that matters when we're talking about healthcare access. And, this is really important because a lot of times there's just inadequate language support in healthcare. And when we are thinking about, even what kind of training people receive in medical school, only 1 in 4 US teaching hospitals provide training for doctors to work with interpreters. And all of this matters, right? Like for people to be able to communicate with providers when they're in a healthcare crisis. And I this part is really about, when we don't have adequate language access and language justice is an issue for our communities, even though Asian Americans have high rates of insurance coverage, if people aren't receiving that education or the information about what they need in terms of being able to access that care, it leads to people simply not accessing it. And that really comes up in a lot of ways, in spite of having health insurance coverage. So for an example, chronic hepatitis B is actually one of the worst health disparities in the country. Asian Americans are only 5% of the population, but we make up more than 50% of Americans living with chronic hepatitis B. And most people don't even know that they have it and aren't even tested. And this often leads to liver cancer. And so here's just an example of a flyer that the CDC had. But this is only 3 languages, and there's still so many other languages that our community needs. Another example of insufficient language access and not getting screenings is cervical cancer. So Asian American women have the lowest cervical cancer screening rate of all racial and ethnic groups in the US, and we have pretty high mortality from cancer as well. So this is another example of educations or materials not reaching the Asian American community, even though we have health insurance. And then there are just so many other disparities when you break it down by groups. And I mean, we could talk all night about it, but I don't think there's enough time. But for certain groups, we have, for example, heart disease is a health issue that really affects Asian Indians. That might not affect other groups as much. For Japanese and Chinese, stroke and cancer mortality are some issues. For Filipinos, diabetes and suicide is a pretty significant health challenge as well, facing Korean men. So these are just a small example of some of the health disparities that are facing our communities. And I want to talk about Medicaid expansion as well and what this means for North Carolina. So Medicaid expansion is really one of the biggest healthcare issues that are facing our state, and has been for a long time. And we've been working on expanding Medicaid for many, many years in North Carolina. And I want to talk about how this affects the Asian American community. So just a quick overview of Medicaid is that it's a program that's administered by the federal and state government. And to qualify for Medicaid right now in North Carolina, you have to have a low income and fall into one of the following categories that are on the screen. So you have to have low income and be pregnant or someone who is blind, elderly, living with a Social Security certified disability, or having dependent children. And we are in North Carolina, only one of 12 states that have not expanded Medicaid. And what this means is that because we haven't expanded Medicaid, we have something that's called a coverage gap. So there is the marketplace, which was created by the Affordable Care Act. And a lot of folks know that if you go on the marketplace, you can receive a subsidy to purchase your health insurance and pay for your premium. But those subsidies only are starting at 100% FPL to 400% FPL, federal poverty level. If you earn less than 100% of the federal poverty level, then in North Carolina, it's really, really hard to get coverage if you don't fall into one of those categories that I talked about on before, like being pregnant or blind. So, and this is because when the ACA was originally designed by the Obama administration, they just thought that every state would expand the eligibility criteria for Medicaid, but a lot of states didn't, and ours was one of those. So a lot of the people who fall into this category of earning less than 100% of the federal poverty level are people such as those who are cashiers, gas station attendants, folks who are waiting tables, construction workers, sometimes small business owners who cannot get health insurance coverage. So they can't qualify for Medicaid, and they don't qualify to get any kind of assistance on the federal marketplace. So they have no kind of option whatsoever to get health insurance. And in North Carolina, just over 2% of the people in the coverage gap are Asian, which is similar to what we are in terms of the population. And some of the great things that Medicaid expansion would do for the state is, provide more than 600,000 North Carolinians who could get coverage. It increases access to screenings. It would create more jobs, and it reduces costs for everybody who has private health insurance, because people who are uninsured are getting coverage as well, and just has better health outcomes. And I wanted to put this slide in here because the unemployment rate for Asian Americans has really increased a lot since COVID-19. And half of minority-owned businesses are owned by Asian Americans, which can put this group at increased risk of losing businesses and coverage. So we haven't seen the numbers yet, or there hasn't really been any data yet on how many Asian Americans have been impacted by this and lost health insurance, but we can assume that our community has been affected by this. And just some ways for people to help in the advocacy for Medicaid expansion is sharing your story about healthcare. We're going to have some advocacy days that will involve calling or emailing your legislator, or helping out in Twitter storms, or talking to your community about this issue. And in terms of COVID-19, I really want to just cover a few more things too, because there are some issues around here that I think are relevant, which is for folks who may not be following the General Assembly as closely as I do, there are some school reopening bills that have been introduced in the General Assembly. And school reopening has a really significant impact for the Asian American community, because a lot of seniors who are people of color are more likely to live with a school-age child. And even though the research shows that children aren't affected as much by COVID-19, they can pass on the virus to other people within their family. And a lot of Asian American families, as you can see from this slide, we actually have the highest percentage of multi-generational households could be at risk if we try to move to reopen schools too quickly. So I just wanted to share that, because this is a very unique issue, for our communities, and there's a lot of implications that it has, school reopening, for Asian American communities. And then I wanted to share this slide too. This is from Allied Media Projects, but I just wanted to raise up, the xenophobia that a lot of Asian Americans have been facing because of COVID-19, and certainly because of just some of the language that former President Trump was saying about COVID-19. And this is just some artwork that I thought was really nice about, keeping Asian Pacific Islanders safe without police. Then vaccine. I really needed to make sure to share vaccine information with y'all. So there is a link, findmygroup.nc.gov, to figure out what group you're going to be in to receive the vaccine. As folks know, we have a limited supply of vaccine, and North Carolina is giving out the vaccine according to groups. So right now we're in group 3 of frontline essential workers, but that could mean folks from people who are working in grocery stores or teachers. So you can go on that website to put in some basic information about yourself and figure out what group you're going to fall into. Unfortunately, this website is only available in English and Spanish. So that is an unfortunate challenge about that website. But the other thing too with finding a location near you for where you can get the vaccine is you can go to myspot.nc.gov and figure out which places, which healthcare facilities or pharmacies near you are giving out the vaccine. And you just put in your zip code and a list of location vaccine sites will come up. And that's myspot.nc.gov. And I wanted to cover really quickly too, vaccine and immigrant rights, because a lot of the Asian American community in North Carolina are immigrants, like myself. No ID is required. They should not be asking you for ID, but I know that some places have been. If you are finding that you have been asked for ID, please let us know, because we want to let the state know that certain facilities are asking for ID and they are not supposed to be. And we know, and the reason that they're not supposed to be is because having an ID can be just a barrier for people, especially for people who are elderly or people who are people of color. The vaccine is also free. You are not supposed to have to give any paperwork. For an example, if you say that you are a teacher, if you're a teacher, or if you are a farm worker or cashier, you don't have to provide any kind of paperwork to show what kind of job you have. You just say that, you know, you qualify for the group because that's what group you're in because of your job or X, Y, and Z. The information is confidential, so that's just to say that there isn't kind of, you know, any kind of information sharing with ICE. And getting the vaccine does not affect your chances of getting a green card or citizenship. Everyone should be getting vaccinated, and this isn't, you know, this doesn't affect anything with getting permanent residency. And there are flyers available in Chinese, Vietnamese, and Burmese around the vaccine and immigrant rights for people who are interested in that. And there's the link for that.
And Han, really quickly, I just wanted to uplift a couple of questions in the chat, and a couple of comments. One was, and I'm reading these back from a little bit ago. So one was just a comment about the General Assembly refusing to expand Medicaid and perpetuating harm, considering the coverage gap. Another one was, oh, my camera's off. Another one was, Ricky was asking about information in Asian languages. Ricky, I don't know if you want to unmute and remind like what that exactly that was in response to.
I think Han actually answered that question when she was presenting that part of like where vaccine information was available.
Oh, so that was specific to vaccine information. Okay, yeah. Thank you for clarifying. And then one other question was about the facilities are not supposed to ask for ID or paperwork, but are they allowed to ask for social security number?
No, social security number is not a requirement to get the vaccine. They're not supposed to ask for anything. No ID, no kind of paperwork on your job, definitely not social security number. If you have experienced that, please let me know, because we need to let the Department of Health and Human Services become aware of that if that is an issue.
Thank you. And
yes, sometimes they do want to know the age, especially because of the group that we were in, but they shouldn't be asking you for ID to verify your age.
Do we have any other questions before we move into some discussion? All right, well then I am going to put us into some breakout rooms. Before we go in, would just like to put out a couple of reminders and also bump up. Oh, here we go. There is a question, what kind of help would be helpful from Asian Focus?
Like around the vaccine, like getting information out about the vaccine or Medicaid expansion?
Well, can you hear me?
Mhm.
Okay. Well, we've been active in distributing PPEs and masks and going to areas that are on where minorities go, minority groups go. And we're at a point where we are looking at what we've done and what else we can do from here, because obviously it's a retracted situation. We thought it was going to end and we were going to finish, but it keeps on, the job for us, or not the interest for us anyway. We sustain the interest in helping in whatever way we can help. I know Yun, thank you for doing this. You know me, you came to speak with us at AAUW. But anyway, what else can Asian Focus do? We have some resources. We don't have too many bodies, but we can get stuff. And where to direct them and in what ways?
Mm-hmm. I mean, I think, if you can pass out things like the Asian businesses having like the immigrant rights flyers in the Asian specific languages, I think that's a good start. And I think too, and now that I'm doing this presentation, we probably need to have some more information about how to get the vaccine in different Asian languages, because right now it's only in English and Spanish. So I'll have to talk to you, Ricky, about next steps, because that's a really big gap.
Oh yeah, okay. So we have Vietnamese, we have Indian, we have Filipino, and Chinese, of course. So Ricky, you know how to get in touch with us. If you need us to translate stuff, just email me and let me know, and I'll do what you need to do for us.
Yeah,
Okay.
definitely. Yeah, definitely keep in touch. I mean, I'm in regular communication with y'all and through Raj, so we can definitely work together on a lot of that stuff.
Those are good though. How to get vaccines in different languages and the immigrant rights flyers. What you gave to us today, we could even put in there in our website that you don't need IDs, and I wonder if I can get a copy of the PowerPoint. That can you send me a copy of the PowerPoint so I can share it with the other members? Yeah. Okay. Thank you.
You're welcome.
Thank you. Do we have any other questions for Han before we move into rooms? Oh, Shruti mentioned that someone on Facebook Live, they were asked for their license when they got vaccinated. Is that okay?
That's not supposed to happen. Are they able to, could they share which site that was? And I know it is happening because, for an example, my partner went to get vaccinated today because he's a teacher, and they asked for his license too. So what I would like to do is kind of get a list of places that are doing this and have the state contact those sites.
Yeah, so our Facebook viewer said that they went to a Wake County site, but not specifically which one.
Okay.
And Han, I've also heard from some other folks that some sites ask for ID for like their internal purposes, but that they're still supposed to offer you like the vaccine even if you don't have identification or something like that. I don't know if that affects anything.
So that they'll ask for ID, but you could still get the vaccine if you said I don't have it.
Yeah, that's what I heard, but I don't know if that's true or not.
So, excuse me, Ricky. Oh, Hyun, if we have questions like that, we're in a situation where we're in that place and they're making it difficult for us, who do we call?
That's a great question. I mean, we have not figured that out, honestly, in the advocacy community, like what is the hotline? Let me get that answer for you though, Gregoria, because I know that there was one place, like maybe, I think Charlotte Center for Legal Advocacy was thinking about setting up a hotline, but I'm not sure if that happened or not.
Okay, thank you.
Mm-hmm.
I see a question in the chat from Jacqueline. Jacqueline is a junior at UNC and was wondering how students specifically can help with vaccine outreach.
Yeah, I mean, you know, I don't know if it, maybe I think students could talk to their families about it, let their families know, help the community, like with troubleshooting, sharing information about, you know, immigrant rights, or like how to actually sign up for the vaccine. I think that those are ways that students can help. Share things on social media. It's like as much information as we can share with the community about how to get the vaccine, I think is important, because that seems to be one of the biggest barriers, is people just like wondering, how do I even make an appointment? What do I do? So anything that people can do around that, I think is helpful.
I think this is a ping. I think a student maybe can prepare some very short introduction, lot of people, special Asian, because the Asian group, because special the culture different, lots of older or middle-aged people, they not really they have a concern about the safety of the vaccine or something like that. Is still necessary to everyone to take the vaccine. I think maybe students can do something like that to let people better understand vaccine is essential and then it's good for everyone to take the vaccine.
Absolutely, Ping. There is still, you know, people feeling concerns or having doubts about the vaccine, and students having those conversations, I think, are really helpful, because people trust information more from someone that they know.
Thank you so much for all the suggestions. A couple of my peers and I were thinking of starting we started a like Asian health advocacy group on campus, and we were thinking of connecting with some of our public health professors and med school professors to put out like educational information. I was wondering if that like would be something that would be helpful, or just having like public health students and med school students translate materials if needed.
Yes, I think, yeah, for sure, that is definitely helpful. Language translation is really helpful.
Any other?
Yeah. Have you heard any of the incidents that we hear about sometimes about violence against Asians at this time? This is related, I'm sure. Do you have information on that? I guess it's a question for Ricky. Anyway, just Ricky, just shoot me an email. Okay, sorry, Hyun.
Oh, no, you're fine.
Okay.
And I have dropped in the chat as well a presentation that we did recently that covers several different COVID, like lots of COVID information, how it spreads, up-to-date information, and things about the vaccines. It also covers ways to talk to your family and several of the different concerns that folks might have about COVID and the vaccine. So that is there in the chat. We will also email all the resources that are being shared following this. And
Great,
so, great. So if no one else has questions, I will go ahead and put us into breakout rooms. And I can go ahead and drop some of the questions. These are some suggested prompts to discuss in your rooms. And for Asian American mental health, we also did a session on that. It was either last week or 2 weeks ago. Time is all blending together for me, and I will drop a link for that in the chat as well and follow up with an email. Right, last week. Thanks, Ricky. And we have another question from Paige. Are there any groups across the state doing work around support for older adults, either related to social isolation from COVID, that kind of thing? And so if anyone wants to raise up any support groups there, please feel free.
You know, folks, the place where seniors are, aside from the private homes, I'm talking about long-term care and housing for seniors per se, you're not allowed to go there. Nobody is allowed to go into the premises because of COVID. But what we can do perhaps is put in our websites, I mean, use social media instead. Put in the websites, the kind of things that we were talking about today. I don't know if they are going to read it. I know some of my friends who are in these housing areas for seniors, they have email, and they join me for Zoom sometimes, and they have access to websites. So how to reach them in the social media would probably be our question. Solution? I don't know. Question.
Yes.
How to reach them via media. Yeah.
Right. Definitely. I think that's definitely a question and something that we can all participate in. I also want to uplift something I think is related that came up in the Facebook chat. I think this event needs language interpreters to reach out to the wider community with the English language barrier. This event is only for those who can understand English, who have internet, and there are people who need to get vaccinated but don't have the help and resources. And I absolutely agree. And that's something that NCAT's certainly working on and could always use the help distributing some of this information. And we have been doing in the past some relational organizing work. So that means that people who are super dedicated in the community and want to help get information out there can organize together to kind of take this information and share it to their networks. And then from there, asking those same people in their networks to share it with them. So kind of just like going down, kind of like a game of telephone, but without the misinformation. And so that is something that NCAT is working on. And if folks are interested in participating in that kind of thing, please let us know. I've already taken note of people who have mentioned that already, but if you haven't mentioned it, please feel free to drop that in the chat if taking that kind of action to share this information out with your networks is something you're interested in. As far as the language barriers go as well, and I think Ricky can speak a little bit more on translation, but that is like an ongoing effort. There's so much information out there that I totally agree is hard to get to people when they don't understand this. So part of that will be tied in with relational organizing, and part of that I will leave back to Ricky if you have anything to add about that piece.
Yeah, Hyun, I have Zoom, and if you put me in your list, we should have a list of people who are willing to come on in real time. I mean, when you call, we could be available. If you have a list of people like me who will be available at a certain time, then you can call and we can intervene or translate whatever is needed. Okay.
Like a hotline, that's a great idea.
That's it. That's what I mean.
Yeah, and I just want to put in there that we are actually building up a core of volunteers who have interest in language ability for things like the one-on-one outreach to help answering questions, particularly both around like this sort of stuff and also like our voter outreach work as well.
Definitely. And I think that, yeah, the more people we can add to that network, the better, considering that I want to say that I could be wrong about this number, but there are like 30 plus different Asian languages that are spoken in North Carolina that we know of so far. And so sometimes, you know, definitely having as many volunteers on that as possible would be great. So
I can share very quickly. I brought up the point of voting, and I think a few of us did, of like, all of these different issues like healthcare, mental health, or just any issues that affect us in our communities. It all kind of links back to voting and who is in office and represents us, because they have the power to like make laws and pass laws that can actually help us in our communities. So the importance of voting, making sure our communities vote and stay educated. Yeah.
So from our group, we talked about potentially putting together compile some existing resources into a little toolkit that we can use to, in a relational way, talk to our community members about, how could be something anywhere from like how to navigate the healthcare system, or like, disseminate accurate information about vaccines and things like that.
Another takeaway I really appreciated from the group that I was in too was like the idea of if you already fully understand English, already difficult to navigate so many of these things, like the concepts of Medicaid, Medicare, how the system works. In the first place, it's difficult on top of not just understanding that piece, but also when you go to the doctor, being able to advocate for yourself, knowing when to do additional research, when not to, even when you already speak English. And so with that additional language piece, it's pretty tough. And there are translated resources for the more technical pieces of Medicare and Medicaid that were shared in the chat. But I think that there's not as much translated information about how did the healthcare system get here in the first place, and like all these other less technical things. And so I think that's definitely a gap that we would love to see closed.
I like that, Hyun. I like how you summarized what we talked about. But we also, in addition, talked about how to use the Medicare booklet, which is hard to navigate if you need it, because the system is fragmented and we don't know about the fact that when you go to a specialist, for example, you only talk about your shoulder or whatever it is, only that part. And there's no one, maybe aside from your primary doctor, we don't have gerontologists, talking about our older people, who will look at the holistic picture, that one part affects the other, and so on. It might be good for us, Ricky, to look at what other services are in the community that are more holistic, so that we're not just going there for procedures, but going there to get help about why am I sore here? Is it connected to my spine, or, the interconnections of the systems of your body is not something you get from the health system right now, because you go to a specialist and they only talk about one part of your body, and you're still left with all the pains and aches and you don't know what's going on. So anyway, that's what I got from our group. Thank you.